when just moving on to the next one, then is obviously another taking pressure off healthcare. So you shouldn't have to wait weeks to be able to see a GP or health professional, yet the major parties' healthcare policies have led to just that. Weeks-long waiting times to see a doctor and constant ambulance ramping at our hospitals. Family First will take the pressure off our healthcare system by investing in frontline medical services. We'll increase GP availability and force the major parties to finally prioritise fixing the ramping crisis. So this is quite a big one, but I want to premise kind of where I'm at with my thinking, so you can sort of maybe answer that as well. I've caught up and I've interviewed Professor Ian Brighthope, who is very much into integrative medicine, the wellness centre. So looking at dealing with health and disease before it gets so bad where people have to rely on a health system or sickness system. Are you, or do you believe Family First Party yourself, in favour of looking at those sorts of things and talking to health professionals that are into that integrative medicine and wellness kind of thinking, to look at freeing up our healthcare system? That's one thing, building more hospitals, putting more beds in, putting more ambulance in, but is there scope to be able to underpin better health in the first place? What's your thoughts on that?
Well, we don't have a policy on that, but my view is that health comes from our bodies and not from medicine. So we have to look after our bodies, and that is sleep, exercise, diet, and community. And that's why we argue for family first, because families are the best social security network that has ever been invented, and healthy families lead to healthy people. That works in a number of ways. In simple ways, healthy families communicate healthy eating. So my wife helps out in a program to help young mums who are at risk of losing their children to social welfare because of various problems that they have. And one of the things that she says is a lot of these young mums that she has to deal with, they don't know the simplest thing about cooking or the simplest thing about how to buy good food. And so they do the easy thing like buy junk food, etc. Now, that comes from a failure of family life way back when they were kids. Because my wife comes from, her dad died when she was 9. She was brought up by her mum. She and her sister, mum was a single parent. She was a nurse, she worked, but she taught her daughters how to live. She taught her how to cook properly, how to eat healthily, and and my wife went on and became a dietitian. And so that is a fundamental issue. And this is a bit unrelated to what you said, but it isn't really. The breakdown of the family unit in Australian society is a significant cause of a lot of the health issues that we have. And I know that a lot of the mental health issues that come across the paths of doctors are as a result of what's happened with broken families. That is a really serious issue. And I know some young people who run camps for foster kids, and some of the problems these foster kids have, it's a direct result of the breakdown of families. So that's a really important issue in terms of answering the whole healthiness of our population. And I think if we can do something there, we can help with all of that, the whole integrated medicine, etc. Because that sort of stuff is, while we now have experts, and nothing wrong with them, in integrated medicine, etc., a lot of that's caught in the home, in a healthy, functioning home. So, and that's front and center Family First policy.